And I would like to thank everyone again and hand us over to, I believe, Dana, who will be helping us with the next portion of our agenda.
Yay, thank you, Victoria, for that amazing Dinamica. I hope everyone enjoyed it as much as I did. Hi, everybody. I am Dana Hunter. I'm a co-investigator with Arizona State University. Excited to be a part of session 2. All right, so in each of our sessions, we will spend just a little bit of time quizzing everybody to see what you learned in session 1. Just kidding. But we will spend just a little time reviewing what we discussed in the last session. The purpose of this is to help us cement the knowledge and create the connection from one session to another. It's also a way to make sure if we have any new folks that you're brought up to speed. So in the next few minutes, we'll just ask a few brave volunteers to come off mute and share with us or put in the chat your responses. And we're just going to start with just a simple question of, what do you remember or what stood out to you from our first session? Just a few brave folks. We talked about evaluation, but what stood out in our first session centered around evaluation? And you can come off mute or you can drop your responses in the chat.
And just as a note, I am not able to update the Zoom settings so that everyone can message everyone in the chat. If you send a message to me, I can share out loud, or feel free to come off mute to share your ideas with the group.
Thank you, Lauren. Okay, so we opened our discussion in session 1 on evaluation. Anybody remember a little bit about what we discussed? Any takers? Anybody want to come off mute? If not, I'll just jump right into the recap. And let's see, I can't see it. It's someone, okay, we have a hand raised, Noelle.
So Dana, I think that in session 1, we were introduced to this participatory evaluation graphic that some of us have as our background today.
That is correct. Thank you, Noelle. We talked about the graphic, and we also broke out into small groups where we went into more in-depth discussion about the graphic, participatory evaluation graphic. Thank you, Noelle. Anyone else wants to jump in? Does anyone want to share anything that you remember from your breakout groups about the graphic? You guys could help me see if there are any comments in the chat. Okay, so we're going to move on. Thank you, Noelle, for being a brave soul and hopping right in. All right, so just a brief recap from session 1. From session 1, we talked about what came to our minds when we hear the word evaluation. We reflected that many of the words, when we talk about evaluation, can seem like academic jargon. It can sound technical, and sometimes even forbidding. When we talk about evaluation, maybe even when I mentioned evaluation just now, sometimes it can seem intimidating, right? And so we shared a more simple working definition of equitable participatory evaluation, which should be up on the slide. The next slide, there we go. Yep, it's up. And so when we talked about evaluation, the definition that we shared of equitable participatory evaluation is that it is an approach to assessing the strengths and weaknesses of a program, intervention, or activity. And then not just looking at what's good about it or what's a weakness, it's also making recommendations for improvements that is conducted in partnership. Here's the key word. It's conducted in partnership and is informed by the worldview of those directly affected. And so when we talk about equitable participatory evaluation, it's not just those professionals, those with degrees and experience or expertise looking at a thing, looking at a program and giving their assessment of strengths, weaknesses, and making recommendations, but it's being inclusive of those with lived experiences, bringing them to the table. As we mention all the time, popular education and people's education is putting value on the lived experiences and the knowledge of those from the community, those community health workers, and those with lived experiences, hearing their strengths, weaknesses, and recommendations as well. And so that's what evaluation is. And all of us have had experience in checking out a thing, checking out a program, checking out a service, and saying, what did I like about that? What did I gain from that? What could have been done differently? And then making those recommendations. So again, that's just a simple way. And then as Noelle mentioned, we looked at the graphic that was created for this community of practice and a graphic of equitable participatory evaluation process. And we discussed the fact that the process is depicted, although the process is depicted as circular, it is really iterative. There's repetition. Every part of the process is equally as important. We explained that in each session of our community of practice, we will focus on one or more steps illustrated in the graphic and the process. So today, we will focus on your team's current engagement in equitable participatory evaluation. So with that, we're going to go ahead and get this thing started, and I will turn it back over to Penny. Thank you all.
So I don't actually think it comes to me next. I'm trying to see exactly where we're at.
I think it's me, Penny.
I think it is too, Noelle. Thank you.
Yeah, absolutely. So thank you so much, Dana, for that wonderful review of our first session. So when we are striving to do equitable participatory evaluation, in order to create the best chance for success, we believe that it's helpful to increase certain conditions of readiness that include building the participatory evaluation team, which is the first step in the graphic, and also choosing an approach, which is the second step in the graphic. And today, to talk about how they have done those two steps, we have the pleasure and the honor of having our colleagues with us from the North Carolina 2109 site. And I'm particularly excited to have our colleagues from North Carolina here because I have the pleasure of getting to be the liaison from our 2110 team to the 2109 site. So when we started to think about, wow, what would be a great team to present about these first two steps in the graphic, I immediately thought of the North Carolina team for many reasons, but definitely including the degree to which community health workers have been really meaningfully engaged in creating and implementing their evaluation. So today with us, we have Lorene, Melissa, Jessica, and Gretchen, who are going to share with us their experiences of building and sustaining an equitable participatory evaluation team. So at this point, I'm going to pass it over to our colleagues from North Carolina.
Thank you. I guess I'll go first. So welcome everyone. My name's Jessica and I was a former CHW for almost 5 years working in Western North Carolina. And I just hit my 1-year mark as a project manager at MAHEC, which is Mountain Area Health Education Center. And it's one of the AHEC sites. There's several sites across the state. And one of the main things is recruit, retain, and just train health professionals and specifically community health workers. My job for certain just training modules and educational concepts. And so one of the main things that NC AHEC is doing right now is creating specialty training modules for community health workers. And it's all to prepare CHWs to partner with primary care practices as part of the new Medicaid managed care network. And so one of the main things, and I will share my screen right now. Share. So we have a website, a link here, for the community health worker program, and it definitely explains just community health worker integration into primary care, advanced medical homes, which is a program through Medicaid. And so, like I mentioned, the specialty training modules, we're in the process of developing many English modules and also their translated versions. And so as you can see, the English is pretty lengthy. We have recently onboarded bilingual CHWs to be able to review these translated modules to ensure that the language and specifically the CHW language is there, and it's the quality is the same as English as it is in Spanish. And so within these modules, we have a post-test for all CHWs to complete. And so here's a bit about the CHW standard evaluation questions. So far, we have 2,369 responses from the number of learners that have completed these trainings. And one of the first questions is just to rate the following statements based on your experience with this educational event. The information presented will enhance my practice or daily work. As you can see, we have a lot of good feedback. My overall expectations were met. A lot of strongly agrees and agrees. In regards to just their experience with the educational event, the content was fair, balanced, and free of bias. A lot of yes, the majority, 99.2%. The content was useful in helping to meet personal objectives to enhance their professional capabilities. A lot of positive feedback. The registration process, that's one thing that we've gotten a lot of feedback that can be not very useful, not very user-friendly. And so that's one thing AHEC has definitely been working on to ensure that the registration process is a bit easier, not going through a lot of ins and outs loops within the registration page. And so if they answered neutral, disagree, or strongly disagree, or no to any of the statements, they're definitely able to provide feedback. Someone mentioned they have extensive experience in the mental health field, so much of the training was a recap for them. They do not feel as though they have learned anything new. Some feedback may be related to HUVA. This was for the North Carolina Community Health Workers Summit that was hosted in December. And so we definitely got some feedback with the platform that was used. Like I mentioned, registration was difficult. It was difficult to sign up. Navigating the site is a bit daunting, so that's something NC AHEC is definitely working on. And then we also like to get feedback on video and audio for the events. Our team that's in the module development process of this all, they definitely work extensively to make sure the quality is there. They're able to list one thing they learned that will be incorporated into their daily work. A lot of good feedback with here, C3 project and community health worker competencies, collaborating with other CHWs. They're able to provide recommendations for future topics, relevant hot topics, clinical knowledge or skills that they would contribute to, that will contribute to their learning. So we definitely have gotten a lot of feedback here. And then that's just, yeah. Oh, here's all the responses, is because there's 1,830 responses. So this is a bit about just the NC-AHEC side of things when it comes to evaluation. And then I believe it goes to
me.
Yes.
Good afternoon, everyone. My name is Melissa Elliott. I am a community health worker / evaluator, and I'm also one of the regions for North Carolina ambassadors with the North Carolina Community Health Worker Association. That's a lot. I also deploy community health workers in a nonprofit organization. So you're talking about expert. I feel like I'm a super expert without a cape on today. So I'm grateful for this space. And my job today is to talk about training and the association's advanced levels of training and certifications that we offer. So as my wonderful colleague Jessica has already shared with us about the trainings that come from AHEC, a lot of those trainings are done by community health workers, and it is our job to get them to register and take these trainings. The trainings are so important because the multidimensional skill set of a community health worker, this gets to get them more involved and more engaged in the work that they're doing. And so AHEC, along with other entities, they offer trainings that give the community health workers specialized certifications, if you will, in different populations. The ADHD that they're just rolling out for community health workers through AHEC in April is something that we're promoting, along with Duke University does what they call CHW 1.0 and care case management, and a 2.0 and care case management. And so there are many different trainings that can be taken, and we encourage, as the association, individuals to do that. We also encourage them to get certified, which is something I want to talk a little bit about, through the association, because once someone takes the SCCT training, they feel like they are certified. But in North Carolina, it works a little bit differently. Through the association, you have to fill your application out. And so there are two different ways to become certified in North Carolina. So we have the training with the SCCT, which are the core competencies and the C3 model of training, where you actually go to a community college. We have 9 community colleges in North Carolina that offer that curriculum for community health workers. That is one way to get certified. We also have what we call the legacy track. The legacy track is a person that may not have the skills to go to class, but have the skills on the ground of doing the work as a community health worker, or for whatever the reason is, they may be challenged through the computer. They may not be able to go to class, but if they have 2,000 hours of training under their belt, they can apply through the legacy track and get certified as well. Right now, the association is working on what we call advanced levels of training, where they can get a specialized certification of a CHW 2, 3, or 4. The CHW 2 has to have experience and knowledge of at least 3 to 5 population groups. So we can talk anywhere from justice involved to at-risk youth to people that are challenged with hypertension. They need 2,000 to 4,000 hours of documented and verified experience with a letter of support. A CHW3 can have experience and knowledge of 5 or more population groups with 4,000 hours of documented and verified experience with letters of support and equivalent. And the CHW4, which is the highest level. And again, these are levels that we are developing right now. They have not been rolled out, but we will roll them out at the end of the spring, first summer. So the CHW4 is 4,000 hours of documented and verified experience with a letter of support and equivalent documentation of specialty training or in-depth proficiency and letters of support. So you see that we are trying to make sure that CHWs are recognized and that their specialized training and all of the service and the hours and the different populations that they work with, we want them to be recognized and have the certification, if you will, to show that this is what they are and this is what they've done. And so that's the training piece. And so the training is also for professional development. We want to make sure that CHWs have a voice and that they are certified and credentialed. So that's where AHAC really comes in and helps us out a lot. Also with the community colleges that do it as well. So now I'm going to talk a little bit about the CHW Roundtable, which we are in partnership with Partners in Health, PIH, and we have a young man by the name of Gabriela that does a wonderful job in coordinating these roundtables. These roundtables are to make sure that community health workers have a voice. And so we have community health workers that come on. We market this and promote it through social media, through all of the community-based organizations, the hospitals, the bigger institutions. We send them an email so that they can sign up, they can sign their community health workers up, and they can get the community health workers in the room, and the community health workers can ask questions. They could talk about their challenges, their barriers, their successes, and then the community health workers get to network with one another and talk about, you know, answers to a problem that someone may have in the east part of North Carolina and someone in central North Carolina may can answer the question of the person in the east. So these roundtable discussions are very informative. It empowers the community health workers. We already know that they are the trusted messengers of the community, but they also are motivators and inspirers. And I mean, we wear so many hats as community health workers. And so that roundtable is very important. We do that once a month. And we also have breakout groups where we can have smaller, intimate conversations like pay rate and how much does the individual should they make? Like, what should that look like for a community health worker? So you have some community health workers that say they make $20 an hour, which is a pretty much livable wage here in North Carolina. But then you have some that say they only make 10. And so those are some of the questions and some of the takeaways that we have to sit back and ponder and try to figure out, like, why is one community health worker making $10 an hour doing the same thing that someone in the east is making $20 an hour? And so we get a lot of information from our roundtable discussions, and it also empowers the community health workers to know that they have a voice at the table, a voice in the room. And so the community health worker roundtable discussions are very, very important. And I think that's the end of what I have to say. So I think it goes over to Gretchen. Go, Gretchen.
Hey, y'all. I'm Gretchen. I get to work with my colleagues Jessica and Melissa. I'm an evaluator at the Department of Health and Human Services in North Carolina. And so just expounding upon what they both said really, really well is the importance of training, the importance of listening to CHWs with the training. So getting the feedback that Jessica talked about to make sure that the trainings are what CHWs want. And then to echo what Melissa was saying, the importance of listening to community health workers. So those roundtable discussions are really informative in giving CHWs the space to have voice and help one another with their problems, because they are the experts and they might know how to solve it better than we can. And so the next thing that we're going to talk about, and we're almost done with talking, and then we're going to put you guys out in breakout room. So you're almost done with listening to us talk. But the next thing, and I'm going to pass it to my colleague Lorene to talk about this, is we wanted to talk about the workforce a little bit. And so what we did is we sent a workforce survey to about I think it was around like 100 organizations in North Carolina in the early fall of 2022, and we got 48 responses. And in that group of responses, there were a range of individuals that filled out that survey. Some were community health workers, some were CEOs at organizations. But the purpose of this is to kind of get what Melissa was just talking about, to understand how people are being paid across the state. What are the training recommendations? Because we know that's really important to CHWs, is the training. How are CHWs deployed in the organization? Do they align with the C3 project and so on? But then we took it the next step. So the survey was something that DHHS created, but what we realized is relationships are more important than that. And so we are going beyond the IR4 measure and just collecting the number and types of organizations, but now CHW leaders are beginning to form their own evaluation questions to reach out to the organizations about. So I'll pass it to Lorene to expand more on that.
Hi, everyone. My name is Lorene. I'm also a former community health worker and currently a program associate with Partners in Health. So I've been assisting in the background or the back end of the evaluation process by taking notes and collecting some of the themes from the workforce survey that Gretchen was talking about. So as Gretchen explained, the CHW workforce survey was developed in partnership with the Office of Rural Health and the North Carolina Community Health Worker Association. And both of these groups really rely on CHW input in order to support the communities in various ways. So it was absolutely necessary that CHWs are involved in analyzing the survey data. A couple of points on how community health workers were able to contribute and still are contributing in this evaluation process. To start off with, the Office of Rural Health in North Carolina convened 2 community health worker ambassadors from their team and 2 community health worker coordinators who work with the association. So together, they have attended multiple meetings that were set up by Partners in Health. And both sets of ambassadors and regional coordinators were able to meet, talk about some of the things that were on the survey, and developed sort of a way to review the survey data and come up with some follow-up questions that they found were striking or interesting based off of their own personal experience, having that lived experience as community health workers. And these are questions that, like I said, they'll get to explore one-on-one with each of the employer organizations in greater detail. Some of the questions that the community health workers came up with, and this is just some because they came up with a lot, but number one, they focused on like the sustainability of CHW career development, like the development path. They also wanted to focus on the qualifications of being a CHW. So they really emphasized that that lived experience was important. They wanted to understand from employers what they thought was most important about that. And then they also wanted to have the employers be able to discuss the challenges CHWs have in these regions and what are the strengths of some of these regions, strengths and weaknesses of some of the regions as well. So overall, it's really beneficial to have CHWs be involved in our evaluation process. Number one, because their conversation and insights allow us to learn about different trainings and policies, how CHWs are involved and included in different sort of healthcare settings. It also helps us to identify priorities and then different communities or healthcare settings. And then finally, it allows us and the CHWs to identify key partners who would be helpful in promoting the CHW program as well. And that's it for me.
Thank you so much to our colleagues from North Carolina. I just want to see if any of our 4 colleagues have any remaining remarks that they'd like to make before we move on. Okay, if not.
Well, I have one, and I
Yes,
felt
Melissa. Please.
I'm so sorry. So the map of the community health workers that are certified across the state, it's showing probably 1/3 of the community health workers that actually have gone through the actual training. And so one of the jobs as ambassadors, we have 6 across the state, is to get to these organizations that have people that have gone through the training at the college and get them to get certified. Because some people think once they get the certification that they are actually certified, and they are not. So we are promoting that because the job of the association is to support the community health workers at any level. We want to make sure that they all get their certifications. I forgot to say that, so sorry.
No worries, Melissa. Thank you so much for adding that. So if our colleagues from North Carolina don't have any more to add right now, let's show them a lot of love with emojis and hand claps and whatever way you feel like appreciating them. I appreciated so much about your presentation, and especially Lorene at the very end when you talked about the really unique knowledge and skills that community health workers bring to an evaluation team. I think that is among the many, many reasons that when you're forming your evaluation team, you definitely want to make sure that community health workers are not just involved, but they're in leadership there. So now we're going to move into some cooperative learning groups to discuss the questions that were posed by our colleagues from North Carolina. And a main idea, so I wanted to go back a step and say that that's fine. It's fine, Lauren. We are trying to familiarize the group with a variety of popular education methods in these community of practice sessions. So we've used dinámicas, we've used brainstorming. In previous sessions, we've used sociodramas. And right now we're going to use a new, maybe for some, popular education technique that's called cooperative learning. And the reason that we use cooperative learning is because one of the main ideas of popular education is that we need to consciously practice the skills that help us work collaboratively. And cooperative learning was really developed to help us practice those skills. So the basic principles of cooperative learning are that we work together in small groups to complete a task. Everybody has a role and a responsibility to make it possible for everyone else to participate. And another principle is that, in fact, we can't complete the task unless everyone is participating. And finally, usually when we're using cooperative learning, we spend some time at the end reflecting on how the groups work together, because cooperative learning groups have both a task goal, so completing the task, but also a social goal of building those skills that we need to work effectively in collaborations. So we move on to the next slide, Lauren. And there's a variety of ways of creating that mutual interdependence in cooperative learning groups. One of them is just to divide up roles, and that's how we're going to do it today. So in our groups today, we're going to have a facilitator, a recorder, a reporter, a timekeeper, and if there's a fifth person, we can have an observer. And I just want to stress that the observer does get to participate, but the observer is also charged with sort of paying attention to how the group is working together, and then sharing that input at the end so that we can continue to improve those collaborative skills. So if we could move on to the next slide, our colleagues from North Carolina have presented some questions for us to reflect on in the cooperative learning groups. And they wanted us to stress that in your groups, you can focus on the questions that are most alive for you. So you don't need to feel like you have to answer every question. But generally, some of the questions that they have posed for us are, why do we want community health workers at the evaluation table? What do the community health workers get out of it? And then, are we paying them for their expertise like we should be? And you'll see this theme of the importance of community health workers being equitably compensated for their expertise coming up again here. A second question is, what is sustainability like for community health workers? Or you can also think of that as, what does sustainability look like for community health workers moving into the future? We're sort of moving out of the intense pandemic phase when there was a lot of funding made available for community health worker programs. And now we're moving into a different phase. And what does that mean for sustainability? And our colleagues from North Carolina also wanted to ask, like, are organizations using community health workers just so they can get their numbers and move on? Or is there a stronger commitment to this profession? And then finally, our North Carolina colleagues wanted you to talk about, how do we compensate community health workers as they increase their levels and skills? You heard from North Carolina colleagues that they're developing a multi-tiered system with 4 different levels. So, and they really want to stress that we can't talk about equity without talking about money. So that's the last question. And I think that Gretchen has already put those into the chat. And we can also message them to you once you're in your small groups. So I believe that at this point, Lauren, are you going to be the one sending us into our cooperative learning groups?
Yes, I will open them right now.
Okay. So please join a group as you receive that invitation. I always feel so guilty when I have to say, oh, we have to close the breakout groups. And I know the group I was in was having a fabulous discussion. So I wanted to give you an optimum amount of time in the breakout groups, which means we have very little time for debriefing now. So I'm not going to take the time to share my screen, but I would love to hear from some of the reporters. I'm just going to read the first question. And if you had something from your group that you really want to share about that first question, please do. And I'm going to ask one of my colleagues to be taking notes in the background. So the first question was, why do we want community health workers at the evaluation table? What do community health workers get out of it? And are they being paid for their expertise? So what were some of the highlights that came up about that question, reporters?
My name is Dr. Tessie Aguzi. We had fabulous conversations. I was trying to take down notes, but it was so much that I could write down a few. So why do we want them at the evaluation table? First of all, to get the facts directly from those affected, and part of the conversation to hear the voice, for them to voice out. Most because they are the most affected people, provide their own experiences. Also, they are the one very close to the community members, so they are able to directly tell us what is working and what is not working. Most time evaluation targets some things, but practically it doesn't work. So the CHWs are the ones to relate this information to us at the table.
Thank you so much, Dr. Tessie. I'm going to go to Adia.
Yes, so my group was fortunate enough to have evaluators and CHWs in there that were able to just share their perspectives. And so what we got is just from the evaluator standpoint, just remembering that the CHWs are people, and remembering that the relationships they share with community members are just something that should be accounted for and respected, just because you have to build that trust. And then also just realizing that the community health workers know the communities in which they work. And so they're able to give kind of that frontline feedback. And then also from the community health worker side, coming in and really being able to see what methods are working. And so although it might be great for relationship building, it may not be great for the numbers. And so just trying to find that common ground so that both can be achieved and that you can have a successful project.
Thank you so much, Adia. So I'm going to make space for one more response, and then I'm going to pass you on to Lauren. And we really want to make enough space for a full evaluation today. So I'm want to honor the time that that Orlando is going to use for our evaluation at the end. So let's go to Chris.
Thanks. To help save you time, I won't repeat. A lot of folks, the same points were made in our discussion, and glad we also had CHWs and evaluators. I think the one thing I would add is the group talked a little bit about how we're better able to accomplish the performance goals that we want in the evaluation if we have CHWs involved and if we understand and are synchronized with what's going on in community.
Excellent reason. Thank you, Chris. So maybe one more response, something that was a real highlight of your discussion that hasn't yet been shared. Okay, well, I thank you for your time in the small groups, and I'm going to pass this over to Lauren for some announcements about our next meeting.
Thank you, Noelle. So announcements are that our next community of practice session will be on April 25th at the same time that the first two have been. In that meeting, we'll be looking at more steps in the cycle of equitable participatory evaluation. So we'll be focusing on identifying evaluation questions and evaluation design. If you or your team would like to be involved in helping to create the lesson plan and co-facilitating that upcoming session, please email me. I'll put my email in the chat and let me know, preferably by the end of this week or whenever you all have a chance to consult with your teams. Does anyone have any questions or concerns about the next meeting? Okay, beautiful. I will hand it over to Orlando.
Hi, everyone. Well, this is the evaluation portion of the COP session of today. I know you must be a little bit tired, so I will ask you to bear with me. Let's wait for to pop up the presentation. Okay, there we go. I wanted to start by asking all of you, what do you find useful from this session? Feel free to answer in the chat or raise your hand and we can go to whoever is raising their hand so they can express what they find useful from this session. Oh yeah, the chat is working. Jennifer McBride.
Yeah, hi. I think what was helpful is just starting the conversation. Like starting the conversation between an evaluator and a CHW. Because sometimes just getting that going can be uncomfortable. I'm just being honest and vulnerable here, that it can be uncomfortable to talk about those certain topics, but it needs to be talked about. So that's what I found to be helpful or useful for today.
Thanks a lot for sharing that. That's a really interesting and important point. We need that conversation to be started, and if this is a useful space, then that's great. Let me see who else have their hands raised up. I don't see other hands raised up, so I'm gonna move.
We have a lot of comments in the chat, but I'm not sure.
Okay, perfect, perfect. Let me see. We have from Sarah, appreciate hearing from other grantees on the work they're doing. If I'm missing any of the comments, please do let me know. I know we have faced problems before. From Rosa, it was useful to hear from North Carolina about their CHW certification program and training resource. From Wendy, it was useful sharing tenets and strategy of popular education. From Chris, it was very useful to learn from North Carolina experience thanks to information on CHW roundtable and other pieces of their work. From Sarah, I agree. It was useful to hear what other states are doing. And we have some other answers. I'm sorry if I didn't read yours, but I'm trying to honor everyone's time. And I know we've been here for quite some minutes. So let's go to the second question. And is there something you would change? Again, feel free to share it in the chat or raise your hand. You can also say there's nothing to change. I love how the COP is right now. All comments are welcome. Oh, please share longer breakout rooms. Nice. We're getting some feedback there for Luis comment. Yeah, breakout rooms with a little more time. Nice. We'll take that into consideration for the next session. Appreciate those comments. And for the last questions, what's one new thing you've learned? Oh, we also. Yeah, thanks for that, Noah. What's one new thing you learned today? Let me see if there's any. I don't see hands raised up. From what I can infer from before, it was also the sharing from another side, which was North Carolina and their experience. We have from Taina, the big importance us community workers have to offer. That's very good to point out. I've never heard of the Dinámicas. It was fun. Thanks. That's awesome that you appreciate the Dinámicas. It's a great process to break the ice and get to know other people and to create community. Sarah share other stairs are doing similar things. That's reassuring. Awesome. And Chris is useful to see the participatory graphic from Indigenous Evaluation Framework. Nice. You can keep sharing all of your experience of or any answer for any of the 3 questions in the chat. Feel free to do so. I want to thank all of you for your time and for sharing those experiences and helping us have a more suitable sessions for the COPs. So I pass it back to who has the farewells, or is it me? Is it me?
I think it's you, Orlando.
Okay, well, okay, let's wrap it up. Thanks, each of every one of you for your time, for being present in this session. I hope you acquire and exchange knowledge that it's useful for your day-to-days and for your experience as CHWs and evaluators. And thanks our collaborators today, the North Carolina team. You did great. It was a great session. So claps to everyone. It was great and hope to see you all in the next session. Take care, have a great one. And once again, thanks for your time.